Hello and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. I'm your host, Jason Howland, and today we're talking about understanding an aging back. And joining us is Dr. Terri Peterson. She is a board-certified physical medicine and rehabilitation specialist at Fairmont Medical Center, part of Mayo Health System. Thanks for joining us today on Speaking of Health.
I'm glad to be here.
Well, today we are talking about back pain, and in particular, back pain as we get older. First off, let's find out exactly how are our spines built? What are they made out of?
Lots of different structures are put together in your back. There are the bones, which are the vertebral bodies, the discs, which are the space between the vertebral bodies. They kind of provide cushions and act as a cushion between the vertebral bodies. Then there are the nerves and the spinal cord, which are within the spinal canal. They control all of the movements within your body and send signals back from the environment back up to your brain. And the spinal canal helps to protect that. The muscles help to hold us upright and support the spine as well.
So it sounds like it's pretty complex. Your back is a complex group of many different things, isn't it?
It certainly is.
Well, what happens to our backs as we get older?
As we get older, the discs start to degenerate, and it actually starts for some people in their teens or 20s, but definitely by your 30s. The discs start to lose some of their ability to cushion. They have a water-like substance in the center, and that will start to degenerate. On pictures, it starts to look black instead of white, and the space between the discs shrink, which is one reason why people lose height as they age.
And that starts even as early as your teens and 20s?
It does, yes.
Wow, and it happens to everyone?
Happens to everybody eventually. Happens to some sooner than others, and that really depends on what you get from your mom and dad, your genetics. It doesn't hurt everyone. Some people it causes more pain and symptoms, but for other people it just doesn't.
We often hear about arthritis in the joints, in particular your hands and in your knees. Mm-hmm. Is arthritis common at all in your spine?
It is very common and actually occurs with everyone as you age, just at a different rate. The first sign of arthritis in the spine is degenerative disc disease, like we were talking about. It's part of the normal aging of the spine. And there are also small joints in the back of your spine called the facet joints, and they have cartilage in them. And just like your hands and your knees have cartilage that wears down over time, so does the cartilage in the back of these joints. And sometimes that can be painful.
What are some of the symptoms?
The first thing you might notice if you have arthritis of the spine is stiffness. As the discs aren't as spongy as they were before, they're not as cushiony as they were, they don't allow as much movement. As new bone forms in the joints, as their arthritis forms, they can't turn quite as much as they used to, so you might have some stiffness turning your neck from side to side when you're driving, or when you get up in the morning it might be kind of hard to get out of bed because your low back feels stiff, just doesn't want to move the way it used to. If you go on a long car ride and try and get out of the car, you might be stiff from sitting there for too long.
And you talked about new bone forming. What exactly is that?
Well, they're called osteophytes, and they can form both around the edges of the discs and the bones where they're connected on the vertebral bodies, and they can also occur at the facet joints. As the cartilage wears down, the bone reacts by forming new bone, and that takes up space. You might have heard of central stenosis or foraminal stenosis in the spine, and when there's new bone forming from the arthritis, it shrinks the spinal canal space, which can cause pain and narrowing where the nerve roots come out.
So your bone is growing, or your body is growing bone when it shouldn't be.
Correct, and that is part of arthritis.
Well, are there certain people that are more at risk for developing arthritis in the spine?
If you've had an injury in the past, you might develop it sooner than you would have before. Also, if your mom and dad have it, like we had said, you'll be more likely to have it and suffer with some of the symptoms. But as we said before, eventually everyone will get it.
Women, men, same ratio?
Same ratio. Women seem to suffer more with the symptoms of it than men do.
So how do you, as a physician, someone comes into your office, say, how do you diagnose them with arthritis of the spine?
The first thing you do is get an accurate history of the pain to or whatever their symptoms are, to help guide what part of the spine you're looking at and what might be going wrong with either the bones or the joints or the muscles that are connected to them. And then you want to do a complete physical exam, looking at the motion of the spine, looking at their reflexes, their strength, their gait or how they walk, and their movement of their other joints as well. But you also want to make sure not to forget to examine the entire body, because there are other medical causes or medical conditions that can cause the same kind of symptoms, so you need to make sure that it's not coming from that. Ultimately, arthritis is diagnosed by an X-ray or an MRI picture, because it's based on what you see on those pictures. But the symptoms that you have, you can treat without getting the x-ray or the MRI scan.
Is it very clear in the x-ray when someone does have that?
Yes, it is.
What does it look like?
The first thing you see are the degenerative disc disease, and so on a plain x-ray, the space between the discs is not as wide as it used to be, so you'll see some that are narrower. The osteophytes, as they form, they appear white around the edges, so you'll see more white, and they're not smooth edges anymore, they get a little rough, and then the facet joints in the back get thicker. On MRI scan, which shows us more detail of the nerves and the discs themselves, you'll see different colors depending on what's being highlighted in the MRI. If it's a picture that's looking at water areas, then the discs start to look black because they don't have as much cushioning in them anymore, and they'll start to bulge when they don't have as much cushion anymore, kind of like a flat tire without air, and the pressure of the spine will push down on it and cause it to bulge either backwards or out to the side. When it bulges backwards into the central canal, that's called central canal stenosis, and when it bulges to the side, it's foraminal stenosis and can pinch on the nerves.
So you determine your patient does have arthritis of the spine. What's next for that person?
Well, education is really one of the most important things. I have a lot of patients who come to me who already have the diagnosis of arthritis of the spine from x-rays or pictures, but they don't always know it. They've been told they have severe degenerative changes, or their back is shot, or you have severe stenosis, and they don't really know what all of that means. So simply educating them on what they have is important. Then making sure that they're doing the appropriate exercises. Stretching can really help to lubricate the joints and keep the muscles loose so you don't suffer so much with the symptoms of stiffness and arthritis. There are some medications that can help reduce pain, but they really don't help reduce the arthritis. Once they have a good exercise program and a good stretching program, then you can work on making sure that they're doing the right activities in their day-to-day life, making sure that they're taking breaks and sitting down when they need to, making sure that they're lifting appropriately, vacuuming appropriately, sweeping appropriately. Those are all things that people can do with arthritis. They just have to know how to do it the right way.
And there is no cure for it.
There is no cure for it. No, it's learning how to deal with the symptoms and manage your day-to-day life.
And I would assume it's probably difficult to manage that and stay active when you have your body telling you that this hurts when I do this. But in actuality, you need to stay active and keep doing those things, or it's going to get worse, right?
You do. It's a very difficult thing because pain is designed to be protective, and so people learn that when something hurts, they probably shouldn't do it. And arthritis, if you're talking about the spine or of the knees or the hips or other things, can be a really hard thing to figure out. When do I push through the pain? When do I cover it up with medications? Or when am I going to hurt more? The one problem with arthritis is when people hurt and they don't do anything, they become deconditioned, which is a medical condition that makes it harder for you then to do your normal activities when you want to. Your muscles aren't in condition, your breathing isn't the way it should be, and your blood vessels and heart aren't working the way that they should be. So then you go out to do an extra activity or something that just needs to be done, such as doing the laundry once a week, and you really suffer with pain afterwards because you're really reaching into the washer, pulling out heavy, wet clothes, and your muscles aren't in condition to do that. So then you might ache for 2 or 3 days after that. If you're able to keep active on a regular day-to-day basis and know how to lift the things appropriately out of the washer, that can become a very simple activity for you to do later.
Are there any ways to prevent arthritis of the spine from at least occurring earlier in life?
Staying as active as you can, staying healthy, and keeping yourself at a healthy weight is really the most important thing to do. The heavier you are, the more pressure you put through your spine as you're walking and doing your day-to-day activities, and that just leads to more wear and tear. Some things put you at higher risk, such as a lot of vibration or riding in bouncy trucks, automobiles, things like that. And so making sure that you don't do that on a continual basis is important.
All right, so I'm having pain. I suspect that possibly it could be arthritis, at least starting. When should I come in to see the doctor?
As soon as possible, so that we can get education, find out exactly what's going on, and make sure that there isn't something else causing your discomfort. Signs that you should come in to see the doctor would be pain either in your neck, low back, or radiating into an arm or leg that's either getting progressively worse or hasn't gotten better in a couple of days of modifying your activities at home. Now, we know we really shouldn't have people be on bed rest when they have an acute episode of pain. They used to do that several years ago, and it showed that people actually got worse and their muscles got weaker and they had more pain long term over the years. Warning signs that something might be more serious with your spine would be difficulty controlling your bladder, difficulty walking, suddenly tripping and stumbling, or if you're having pain and weakness in an arm or a leg. That would be a sign that you should come in and be seen right away.
And what happens if you are having serious signs like that when you do come into the doctor?
That's a time when potentially imaging sooner rather than later will be done to get a detailed MRI scan looking at what's actually going on in the spine. Sometimes there'll be a herniated disc, sometimes it's the combination of the arthritis that's causing the pinching and the narrowing. And depending on what's seen, your doctor may want to order an EMG, which is a test looking at the electrical function of the nerves as they come out of your neck into your arms and your legs. That can tell them if the pain is coming from a pinched nerve or an irritated nerve, or if it's coming from referred pain, because there are structures in the back, especially those small facet joints in the back, that can refer pain down an arm or a leg that feels just like a pinched nerve, but it's not. And the EMG can help determine which one of those it is. That can be important for treatment because if the irritation is coming from the nerve itself, you could try an injection right along the nerve, or if the pain looks like it's not coming from the nerve, you could try an injection into that small joint.
And when you say injections, what are you injecting?
It's an epidural injection or local anesthetic along with a steroid injection in there, both for immediate pain relief, similar to going to the dentist and getting Novocaine, and that wears off in 4 to 6 hours, and then the steroid that's there helps to decrease inflammation because we think that it's the inflammatory response that the body is having that's creating some of the pain.
When we talk about pain, I would imagine there's a wide range of different varieties of pain, from the very sharp acute pain to just the dull pain that just will not go away. Is there a certain kind of pain that maybe hints towards arthritis?
Pain that is related to stiffness hints towards arthritis. Really, that's one of the first symptoms that you'll see. What can happen though is when you're having that dull, achy pain all the time and a stiffness, then the muscles around that get irritated. They're trying to protect you, to protect your body from feeling that pain, and then they will kind of cramp down, and so it might feel like a really bad muscle pull, or you might have just severe pain all along one side of your spine. That then is connected to your hip muscles, so that too can shoot pain that goes down your leg. That pain is more severe than the dull, achy pain, but they can go hand in hand. When you have a pinched nerve or a herniated disc that's pinching on a nerve, you can get severe numbness, tingling, and the numbness and tingling can get to be more of a burning sensation, and then you'll have weakness of the muscles as well.
So I would imagine physical therapy can play a key role in keeping a patient healthy when they do have arthritis of the spine, right?
It certainly can, and it's one of the most important things to prescribe to your patient. Really, the therapist will help to educate the patient even more than the physician can in the short encounter that they have. And they can teach them the appropriate stretching exercises so they can stay active in the morning and throughout the day. They can teach them the proper way to lift to prevent further pain from the arthritis, and they can teach them the appropriate stretch or strengthening exercises to keep their core muscles strengthened.
And these are exercises that they can do right at home?
Right at home.
Well, that's all the time we have today. We want to thank Dr. Terri Peterson for joining us today on Speaking of Health.
You're welcome.
And the phone number to schedule an appointment with Dr. Terri Peterson, physical medicine and rehabilitation specialist at Fairmont Medical Center. Call 507-238-8547. That's all the time we have. Have a great day, everyone, and be healthy.